we get a widespread uptake of vaccine, we can put an end to this pandemic and we could create a veil of immunity that would prevent the infection from coming back.
Millions of people rolled up their sleeves to do their part to end the pandemic. But for some people, it didn't go as expected.
I got to where I could not breathe.
My heart was beating out of my chest.
Police officer was giving him CPR, and I still wouldn't believe it.
I was paralyzed from the cheeks down.
He was on life support for 6 weeks.
I have no idea what's happening. I haven't been able to find any help.
Andre, are you all right?
Yeah, just having an episode right now. I can't hold my head up right now, so that's what this collar here is for.
I just want to do what I have to do to limit the damage and hopefully recover.
We're told severe reactions to the vaccines are rare, but that's little comfort to those who are suffering. They say they've been abandoned by everyone, except a small group of doctors brave enough to say we're facing a new disease, vaccine injury.
This is a tragedy of untold proportions, which our federal government and state agencies pretends doesn't exist. This is a disease that has to come out of the shadows.
There's still a lot of disagreement around COVID-19 vaccine issues. I wanted to know why some doctors call vaccine injury a crisis, when others don't see a problem at all. And what does it mean to be vaccine injured? I decided to hit the road and talk to as many people as possible to find out for myself.
Every Sunday, I put all of her supplements that are dry and the pills, so the powders and the pills, into boxes that are labeled Monday through Sunday. And then in the morning, I add the formula and then the whatever day it is into the blender and blend it up. And then after that, I put it into her feeding bag, which is used with her pump. And then that is how she gets her nutrition for the day. You okay? Where's the...
I'm able to work from home because somebody's got to be here for Maddie. Transfer her to the bathroom, get her up, take her for walks, just anything. And just hanging out with her because her friend circle has shrunk. It's just mainly I want to be there for her emotionally. Like it's just her and me all day.
I wasn't rich, but I did feel like I was rich with what little I had. I felt like a millionaire because, we have our home. I have my son. He meant everything to me. When I went and took the Moderna, because I wasn't sure, I said, if anything should happen, let it happen to me. I didn't get any reactions at all, nothing, so I felt pretty confident then. Pfizer says that, it's safe for teenagers. He goes, sure, Dad, let's go. Was a lot of confidence in it too. So we went, and like I said, no side effects, nothing.
5 days later, a neighbor knocked at the door, offering to take their son out to eat and play a game of basketball.
I gave him a hug and a kiss. I gave him some money. I told him to behave and be good. And if he needed anything, call me. I never knew that was going to be the last time I'd talk to my son.
Thank you very much. Today, I want to update you on the next stage of this momentous medical initiative. It's called Operation Warp Speed. Its objective is to finish developing and then to manufacture and distribute a proven coronavirus vaccine as fast as possible. Again, we'd love to see if we could do it prior to the end of the year.
Warp speed required shrinking the normal vaccine development process from an average of about 10 years down to a matter of months. That required reducing the amount of time given for each phase of development and doing the phases in parallel instead of sequentially. Trials are normally done in phases so researchers can do all the tests and make sure it's safe enough to move on to bigger and bigger populations. In this case, that didn't happen.
Maddie would always come outside. She was my nature girl. And
she did gymnastics. She played volleyball, constantly moving. She would do cartwheels in the stores, TikTok dances.
So what was it that made you want to do the vaccine trial?
My brother's friend mentioned it, and then my brother wanted to do it, and then, you know, there's like benefits. Well, at the time I thought.
Like what?
Because, well, obviously I would be one of the first people, and I would be helping, and you also get money, so, but not that much.
All three of our kids were in the trial. Our middle son, Lucas, he ended up getting the placebo. Gabe got the 1 dose, and then he didn't get the 2nd dose because he got COVID. And then Maddie got both doses.
Pharmaceutical companies often contract out their clinical research. Ventavia was hired to run Pfizer COVID-19 vaccine trials. Due to the heavy workload, Ventavia needed more help and brought on Brooke Jackson, an experienced clinical trial auditor, to oversee and manage quality control at 2 Pfizer trial sites in the Dallas area. Jackson told me that from day one, she found major problems, which she attributed to the unusual speed of operations.
They were getting pushed directly by Pfizer to enroll more patients. I was having to bring so much to their attention. I've never been a part of a clinical trial in all of my almost 20 years of experience run like this ever.
Jackson says the issues she saw compromised the integrity of the data and patient safety.
The first thing that I would look at is the informed consent form. When I'm looking at one signature page and comparing it to the signature on the next page, the signatures are not matching. Where the principal investigator is supposed to sign off, his signature's missing. The physical exam wasn't done. Something that, as an auditor, I'm trained to look for is repeated data. So you can tell by the laboratory processing log that this person is inexperienced in research. When I look here at this 30 minutes, every patient's blood clotted for 30 minutes. Per Pfizer's protocol, it could be anywhere between 30 to 90 minutes. So this data is falsified. This data is fraud. We were not monitoring the temperature of the vaccine. The temperature needed to be at least negative 70 degrees. I immediately went to my managers and said, this is a serious problem. If we were to be investigated or inspected by the FDA, we would be shut down. The next most concerning of my findings was that everybody that was enrolled in the trial from July through the middle of September of 2020 had been unblinded to their treatment assignment. The site staff knew if the patient received placebo or whether they received the actual vaccine. It was a direct violation of Pfizer's protocol. It should have halted the enrollment of any additional participants, and we should have contacted Pfizer. What Ventavia wanted to do instead was lie to Pfizer, go into everybody's chart, and remove that randomization assignment and destroy the evidence. This is a quote from Christy Rainey, who's one of the owners of the company. She wanted to make the pause in enrollment like it's no big deal. I wouldn't say one negative thing. I would keep it that we were in the perfect place and we were being responsible. The person that was in charge of vaccinating our patients was working, again, way beyond her scope, had no medical training at all, and the position that she held right before coming to Ventavia was at a restaurant. And this was a person, again, that was responsible for preparing the vaccine and the one that was responsible for injecting it. One of my top findings was the lack of reporting of adverse events, and that included some that were serious.
She got off the bus, she was screaming in pain, screaming. Hunched over, holding her back.
Maddie,
you know, my heart's coming out of my chest.
It's like, I can't get out of it.
All right, hey.
He called me at work and he's like, Maddie's having some sort of reaction to the vaccine. I called the trial line, I'm waiting for them to call back, and then in the background I hear her yelling. Her fingers were white and very cold in her toes. She was walking with her feet up, like, because they were so painful. She had told us that she had the zaps up and down her spine. She had a really bad headache, severe stomach pain.
Now, over 3 decades, I've been involved as a clinical investigator, doing original research on my own protocols, or being someone who's been elevated to a steering committee or an executive committee or overall principal investigator. What you've just described, that's a sudden, unexpected, serious adverse reaction. Everybody, within 24 hours, every single institutional review board, the sponsor, all the investigators, everybody has to be made aware because it was not expected.
She went to the ER 9 times and was hospitalized 3 times for a total of 63 days. Maddie experienced over 35 adverse events. In the EUA amendment, Maddie's adverse reaction was reduced to 5 lines that they claim was eventually diagnosed as functional abdominal pain. It's a stomach ache. Does your child, when they have a stomach ache, does that put your child in a wheelchair? Does your child's stomach ache require a feeding tube?
I've got a quick question. Obviously, we invited the CEO from Pfizer or some representative from Pfizer. Nobody showed up. Pfizer has to be aware of you. Have they reached out to you?
Neither Pfizer, the FDA, or the CDC has ever talked to us or attempted to. We have never heard anything from them. I just don't know how you could let a child suffer and potentially die. You know, I just don't understand that. I did think that if anything, in the small chance that if anything did happen, you know, that's when you would want it to happen is in a trial, because then you're gonna get the best care. I didn't think anything would happen, but in my mind, for all trials, that's how it is. That's not how it is.
After trying to take my findings to my leadership team at Ventavia, after reaching out to Pfizer directly, I took the information to the FDA. As soon as I pressed the send button, I felt just this immediate sense of almost relief that, okay, now something is going to be done. But what happened was I lost my job about 6 hours later. Over the next couple of months, the vaccine was being rolled out to pregnant women and to our children, being mandated to our military, our first responders, our healthcare workers. And I just felt this sense of guilt. I was depressed. I was sad. I was learning about the vaccine injured. I had the documents in hand, Pfizer's internal company documents, my company's internal communications. They were working on Moderna as well. Novavax. I've seen the data and it looks exactly the same. So I thought I just need a scientific mind to review the data. I took the information to the British Medical Journal. The editor put me in contact with a investigative journalist, and we spent, a month and a half or more just going through that evidence and listening to these hour-long recordings, and his story was published. I expected there to be a lot of attention, a lot of focus on Pfizer and how these trials were run, and that's obviously not what happened.
Instead, Facebook fact-checkers censored the article, giving it a missing context label and restricted sharing. On December 11th, 2020, the FDA approved Pfizer's COVID-19 vaccine for emergency use. Moderna's vaccine was approved a week later.
In certain types of emergencies, the FDA can issue an Emergency Use Authorization, or EUA, to provide more timely access to drugs, diagnostic tests, or other critical medical products that may help during the emergency when there are no adequate, approved, and available options.
This was March 2020. If you remember, the standard current of care was really no care. The NIH and the WHO said there was no specific treatment. It was supportive care. If you couldn't breathe, you were intubated, put on a ventilator, and you died. It was myself first, and then a number of colleagues. We said, you know what, let's come together with a treatment protocol. We were bedside clinicians. The drugs we chose were very thoughtful and saved lives. It was a valid alternative for people who wanted a choice. But, this was denied.
The EUA process is different than full approval of these products because in some emergency situations, we just cannot wait for all the evidence needed for full FDA approval. Instead, the FDA evaluates the options very quickly using the evidence that is available and carefully balances any known or potential risks of these unproven products with any known or potential benefits to the public of making them available during the emergency.
This is the big difference between vaccines and drugs, okay? Is drugs are typically given to somebody who's already sick. In a vaccine, you're giving it to people who are not sick. You're giving them prophylactically.
Dr. Robert Malone, a pioneer of mRNA vaccine technology, has spent over 3 decades developing and researching vaccines.
And so the risk-benefit ratio is way different in the case of a vaccine because only a subset of these people are actually going to get significant disease.
Breaking news. Pharmaceutical giant Pfizer just announced moments ago that its coronavirus vaccine is
95% effective in trials.
Food and Drug Administration just approved
this for an emergency use authorization that appears to be 95% effective.
It tested more than 43,000 people.
Incredible efficacy, 95% for this vaccine, blew us out of the water in terms of our expectations.
And it has now passed the gold standard of safety.
We will have started distributing millions of doses of safe and effective vaccine to begin protecting our most vulnerable across America.
95% effective sounds impressive, but was it misleading? To most of us, it sounds like if we vaccinate 100 people, 5 would still get COVID. But that's not what it means. It means this. Out of the entire Pfizer trial group of about 44,000 volunteers, a tiny portion got COVID, 162 in the placebo group and 8 in the vaccine group. Comparing these two groups, there was a 95% reduced risk of getting COVID if you got the vaccine. So the vaccine was hailed as 95% effective. But this isn't the whole story. Another 3,410 trial subjects also developed symptoms but tested negative for COVID, so Pfizer excluded them. But we know that PCR tests for COVID-19 are often wrong. False negative rates have been recorded at 54%, 20 to 66% to 67%, especially when done as soon as symptoms appear, as they were done here. If those cases had been included too, vaccine efficacy drops to 19%, far below the 50% needed for FDA approval. The vaccines would not have been approved.
I'm announcing tonight a new plan to require more Americans to be vaccinated to combat those blocking public health.
President Biden issuing his most aggressive COVID vaccine effort to date.
And the new mandate affects 84 million private sector workers.
Probably 6 or 7 years old, I decided I wanted to fly. Started pilot training in the Air Force, and I ended up 31, almost 32 years as a commercial pilot. I got the vaccine because I was mandated to get the vaccine. It was a term of employment as no ifs, ands, or buts. That came down on high as a result of President Biden's vaccine mandate for federal contractors. I weighed the concept, I weighed the idea of, refusing it, but I'm the sole source of income for my family.
Leave it. Leave it. I know, this is the enemy you want to destroy. All right, here we go. Let's get one up in here. Joe!
I was made the Texas Military Department liaison to Governor Abbott's task force for COVID response. I went down to Operation Lone Star, which was along the Texas-Mexico border, along the Rio Grande River. Our troops, I'm keeping them safe by doing nasal swabs with betadine and saline. We're doing the things that I was trained to do as a special operations surgeon in places like Africa, Southeast Asia. We're just doing good medicine and nobody's getting sick. August the 24th, it changed everything. Before you had the shots and you were to offer it. Now they're mandatory. I noticed soldiers coming into the aid station with chest pain, with shortness of breath, with stroke-like symptoms. And then we had to put soldiers in the hospital. First one was a 27-year-old with myocarditis and pericarditis combination. I've seen one heart attack in my career, and now we're seeing them regularly. It's not normal.
I got a really strange sensation, a really odd pain that just kind of came out of nowhere. I said, I must have pulled a muscle or a nerve or something like that. That's really odd. We landed, we taxied to the gate. All I got up was getting my bags to get ready to clear the aircraft. I collapsed. That's all I remember. Suddenly, no warning, no precursor, nothing, just literally out. Fortunately, we had a Navy corpsman and an RN that were deplaning. They rendered immediate assistance. They commenced CPR because I had no heartbeat, was not breathing. The paramedics had been called out for a completely unrelated smoke alarm issue to a very near aircraft, and I received 3 shocks from the AED. I woke up the next day in the ICU, wondering what just happened.
What would have happened had you had gone into cardiac arrest 10 minutes earlier?
We would not be having this interview.
They just wouldn't have gotten to you in time?
No, absolutely not.
The justification for mandates was get the shot, stop the spread, and keep everyone safe.
The vaccines work well enough that the virus stops with every vaccinated person.
In other words, you become a dead end to the virus.
Vaccinated people do not carry the virus, don't get sick.
You're okay. You're not going to get COVID if you have these vaccinations.
It turns out clinical trials didn't even test if the vaccines stopped transmission.
Was the Pfizer COVID vaccine tested on stopping the transmission of the virus before it entered the market?
No, we had to really move at the speed of science to really understand what is taking place in the market. And from that point of view, we had to do everything at risk.
When the government told us that the vaccinated couldn't transmit it, was that a lie or was that a guess? Or is it the same answer?
I think it was hope that the vaccine would work in that way.
Clearly, hope is not a basis for making decisions that would affect literally billions and billions of lives. So we now know that they did not adequately test the safety, and we now know they did not test the effectiveness or efficacy of the product. These are the 2 arms in clinical research, safety and efficacy. From the very outset, we did not meet the normal conditions required to proceed. Now, did we have informed consent? The answer is no. Informed consent, it has to happen with any medical procedure. Patients have a right to understand the risks and benefits.
If it's an emergency use authorization, you must perform informed consent. Got to do it. It's an Army regulation. So this is the informed consent brief that I did on the border. There it is right there. Chapter 8, paragraph 5, 8-5. Required by FDA-approved EUA, full compliance with this requirement is critical. And when I would tell them this, they just say, well, have them look at the package insert. Have you ever opened a box of Pfizer or Moderna? There's a fact sheet that comes with it. It's about this big.
The typical package insert looks like this. It has a great deal of information on it in terms of adverse reactions. So a few months ago, I looked at the package insert. I pulled it from the box of mRNA product. And, it was sealed just like I'm showing you here. And then I pulled this out. And this is what it looks like. So I'd like to show this to you. It's blank. It says intentionally blank on it.
That's what's passing for informed consent.
Right. So how am I to get informed consent to parents when this is what I have?
I'm told by a 2-star on the border, you're doing informed consents. There's not enough people taking these shots. I'm perplexed. I did risk stratification, which is what we do in medicine. I've been doing it for a while. Is to say, you fall in this category, you don't need this. Okay, you 5 people here out of the 3,000, you might need this. Okay, so at that point, when I looked over at my medic and they said, sir, we've had 3,000 people come on the border and you know those informed consents you're doing? I think only 6 people have taken it right now. I'm like, okay, good. I mean, it's their choice. I give them the good and the bad. They reviewed my informed consent. Then they came back and said, we will start doing our own briefs. We'll send people down for it. And I was taken off that and then eventually taken off the border. The same surgeon that gave me a hard time, that fired me from the border, has since retired as well. He sent me a letter. He said, Doc, I'm really sorry about what happened to you on the border. I really was behind you, but the generals were on my case. And I had to do what I had to do. I was following orders. That's a scary thing, because there's such a thing as disobeying an unlawful order.
I want you to put your hand up if you say yes to this question. I was not given adequate information about the potential risks of the vaccine.
For 17 years, I was a charge nurse for a big department that included pediatrics, NICU, labor and delivery, postpartum, antepartum. I was also part of the trauma team. When they told us that we needed to do this to help end the pandemic and to keep our patients safe and our loved ones safe and our family safe, I knew I needed to do it. I had zero concerns.
There were several rumors that it was just a matter of time before it was going to be a mandate. I would risk losing my job, my livelihood as a physical therapist. So I went ahead and did it on the front end.
I was a really big student, 10 hours a day at school, and then on top of that, volunteering at a hospital. They were begging people to, volunteer and help on the COVID unit floors. But in order to do it, I don't feel comfortable doing that without getting the vaccine. So for me, it was my own choice.
As I was leaving the testing site, I was in my car driving, and it was at the 12-minute mark that my life just drastically changed. The last thing that I remember is my entire body just went warm and numb. I began to shake uncontrollably. My heart was beating out of my chest. I started having immediate difficulty breathing.
I was having crazy progressions with my symptoms so fast. And so one doctor's appointment, I just had what seemed like an inflamed wrist, and the next one I was numb up to my back. That's the first time the doctor was like, you have a problem way bigger than your wrist. Like, you need to get your brain checked out. The next day, I went paralyzed on my right leg.
So 7 days after the vaccine, I had gotten so bad that they placed me on the ventilator for the first time to be able to breathe. So that was kind of the first start of it.
Over 80% of the adverse events are neurological, so which is what makes this such a devastating disease.
Dr. Paul Merrick is the second most published critical care doctor in the entire world, with over 500 peer-reviewed papers. Dr. Pierre Corey was chief of critical care at the University of Wisconsin Hospital. In March 2020, the pair co-founded Frontline COVID-19 Critical Care Alliance to work on COVID-related treatment and prevention. Their work then moved into COVID-19 vaccine injury care, since for both the long-haul COVID sufferers and the vaccine injured, their problems are caused by the same thing: toxicity of the spike protein, which is part of the virus and what's produced by the body after vaccination.
We know that the spike protein induces persistent inflammation of several of the immune cells. So inflammation is immune cell activity, which bring about repair mechanisms. And sometimes inflammation is generally overexuberant.
And then they get what's called a peripheral neuropathy, in which they develop antibodies against the nerve fibers. So they get terrible shooting pains, paresthesias, numbness in their legs, terrible pain, burning pains, and which can be enormously disabling.
It's wickedly complex. Every single organ has been affected. The biggest is the neuroinflammation, all of the different mechanisms and how they affect the brain, the heart with myocarditis, the intestines. I have a lot of GI dysfunction with a lot of my patients. They can't tolerate foods. They have new food sensitivities. There is not an organ system that has not been affected. Tinnitus, vertigo, dizziness, loss of hearing, loss of vision. It's unending.
She was in the hospital for 3 days. They sent psychologists in, not a bunch of doctors. And they put the functional neurologic disorder diagnosis into her charts.
And what does that mean exactly?
That it's
In
the
your
way,
head.
yeah, in your head. It's a software problem, not a hardware problem, because they said they couldn't find anything wrong. Mind you, the only test that they had done was an MRI of her spine, which nobody has shown anything that's had a reaction. They didn't do a spinal tap. They didn't do an EMG. They didn't do a skin punch biopsy, even though she couldn't feel from her waist down. One night, her stomach it ballooned, huge. It ballooned up and she started vomiting really hard. We went to a local hospital and of course they saw the FND diagnosis in there and treated her like a crazy person. And I mean, they were literally belligerent.
He started screaming at me basically.
The mind games that they do on you are ridiculous. And they convince you if you don't believe the diagnosis, then she'll never get better.
And that is there's such deep unfairness to the plight of the vaccine injured because, those diagnoses of anxiety and functional neurological disorder, I mean, the high frequency of them is because that the tests are so often normal or minimally abnormal, but just not abnormal enough to explain the symptoms. And, especially on the imaging level, so MRIs, CAT scans, X-rays, just normal. And the patients are so sick. And that really kind of seals the fate of the vaccine injured even more because they're just unlikely to get believed.
After all my tests were done, I finally went back into that neurologist. And he says there's nothing wrong with my results and that I just had psychosis. He then thought it was because I was having boy problems. Maybe your mom's abusing you at home and you're just not telling me about it. Oh, I know why, actually. It's because you're stressed out. You're studying for medical school. What makes you think you could be a doctor?
They say very unpleasant and rude things to my patients. I think they automatically delegitimizes the patient in their eyes because vaccine injury is not a thing.
My neurologist said, oh, I don't want to hear that you had the vaccine. I don't want to hear anything about that.
Within 2 days of my vaccine, I had visited 7 emergency rooms to be dismissed by every single one of them, being told it was anxiety in my head, conversion disorder, functional neurological disorder, given psycho meds, anti-psych meds.
Nobody wants to hear that something bad is going on. I think if people look, you can't unsee.
In the morning, I wake up, you never know how you're gonna feel. Is it gonna be a good day or a bad day?
We're trying to learn everything we can about this illness and all of its manifestations. What I know and what I wanna know are two different things. We don't have good biomarkers or lab tests to tell me what drugs to use. Nothing is proven. Very little research is being done. So I kind of give them the understanding that, I'm doing the best I can. It's not that I need their sympathy, but I do want their trust.
First of all, you sound good.
Yeah.
You sound better than when I saw you last time. Your voice was really weak and you were not doing well.
No.
And then a whole bunch of stuff happened.
Right. That was right after the first hospital stay. And then I got better after that. And then it was a major decline.
Right now, Nikki, you have a G-tube, a trach, and a bladder stem and no catheter?
I still have this suprapubic catheter.
How are you with standing and walking?
Mostly the wheelchair now.
We've been starting to use this really interesting medicine. There's a good case report This medicine seems to help people with a lot of their neurological symptoms. I want to think about that some more for you. Okay. I don't want to overpromise, but I just think it might have a role in helping some of your symptoms because your symptoms are so neurologic.
Yeah. Although the neurologist is not getting me any help, so.
It's one of the most terrible cases. I took her on pro bono, and I've tried to help her, and after her vaccine, the amount of problems that she incurred are just devastating. She's one of my most challenging patients in terms of how much I've been able to help her.
When you hear about other people who get better, but you feel like you're not, how does that make you feel?
It's frustrating because with each time you hear hope and you go and you search out that treatment and you try it, and if you don't have the success that they did, it's deflating what hope you did have. And so it's a setback mentally.
She's definitely responded to some medicines, but it's been much less than desired. So, but we'll keep trying.
Maddie DeGarry suffers from many of the same conditions. The family eventually was introduced to a holistic medicine doctor in faraway Oregon. Desperate, they spent 4 months out there, hoping to see some improvement.
We saw 2 holistic doctors that volunteered their time. We rented an apartment. My husband stayed here with the boys, and they would come to the apartment that we were in to do IVs. They took her vitals. That's where they took her off of all the medication she was on. So everything that she's on is our supplements. So, oh yeah, it's night and day. I mean, she was in bad shape when we went out there.
Let's say 10 was your absolute worst time. What number would you put yourself at now?
Probably like a 6-ish, 6 or 7. I just know I'll get better, so just taking way longer than I wanted.
My neighbor called in a panic, and she asked me to hurry up and get there. When I got there, they were loading him up in the ambulance. I changed the ambulance to the hospital. When I got there, they were working on him at the hospital. And there was a young doctor. He came out after a few minutes, and he, like nothing. It meant nothing. He had the expression on his face just upset me. He goes, "Your son's dead. You can go home." So I was so angry. I grabbed the doctor and I threw him against the wall. I just wanted to get out of there because I couldn't believe it. I got suicidal that night. Some guys I knew, they came. They stayed most of the night outside to make sure I wasn't going to do nothing because they know me and they know how close we were.
The autopsy report shows Ernest's 16-year-old son died of an enlarged heart. In cases like his, a COVID-19 vaccine is almost never mentioned, but there is a pattern.
Any individual case can be argued that there was causation. This is why it took so long to establish the link between cigarette, tobacco consumption, and cancer. In the end, it had to be prosecuted as a class action lawsuit because it could be shown in aggregate, but it's always difficult to demonstrate at the level of the individual.
He got vaccinated on like a Friday, and on Sunday, Sunday morning at 1 a.m. was on life support. He was diagnosed with myocarditis. Doctors, of course, would not say it was vax-injured, but why would a 6-year-old have myocarditis?
My son, Sean, played hockey his whole life. To continue to play hockey, he had to get a vaccine. He took 1 Pfizer shot and died 33 days later. The cause of death is unascertained. He was perfectly healthy with no underlying conditions, and he just died 33 days later. And here in Canada, they're still pushing the vaccine. They want little children to go get it.
You were super duper today, getting your COVID vaccine, Elmo.
Yeah, there was a little pinch, but it was
Okay.
I took a trip up there to the North Pole. I went there and I vaccinated Santa Claus myself.
Children have like almost the perfect recovery rate. Very few children have died from COVID alone, and almost no healthy children have. And yet we are proving it for millions of toddlers in this country.
Meanwhile, in Europe, many countries stopped shots for young people a full 8 months before Elmo got his jab.
Finland has become the latest country to pause the use of the Moderna vaccine.
Like Sweden and Denmark have decided to stop using the COVID-19 vaccine.
French health authorities advise against the use of the Moderna COVID jab for people under 30
due to the risk of heart inflammation.
While acknowledging the same risks, the official recommendation in the U.S. didn't change. Everyone ages 6 months and older should get vaccinated for COVID-19.
12 to 17-year-olds who we're working to vaccinate over the next 4 months, and we can vaccinate 1 million of them, which would be great strides. Over the next 4 months, we could expect 30 to 40 of these mild, self-limited cases of myocarditis.
I can tell you as a cardiologist, it's not mild and it's not self-limiting. Self-limited would mean that they kind of go away on their own, but it doesn't go away. This is not debatable. Myocarditis in some children is fatal. One of the things that's very important in myocarditis, we cannot let them play in sports. The surge of adrenaline is going to trigger sudden cardiac death. 2 periods of time where there's a surge of adrenaline during sports and activity, and also between 3 a.m. and 6 a.m. in the normal waking cycle. COVID respiratory illness is not the big risk for myocarditis. What we know from the CDC evaluation and now over 200 papers that COVID-19 vaccine-induced myocarditis is the big threat to our children.
Steve Kirsch, a successful Silicon Valley entrepreneur, has spent millions of dollars over the past 2 decades funding medical research to cure diseases. After the vaccine rollout, he started to notice that something was going wrong.
I had a friend who said, "Is the vaccine safe?" And I said, "Why do you ask?" And she said, "Well, 3 of my relatives got the shot, and a week later, they're dead, and they were perfectly healthy before." And I said, "Well, that's impossible." She said, "Yeah, but they're dead." And then a week later, my carpet cleaner shows up. He's wearing a mask. I'm giving him a hard time. I said, "Haven't you had the vaccine? If you have the vaccine, you don't have to wear a mask." And he said, "Well, I was only able to get 1 shot." And I said, "Why? Why didn't you get the second shot?" He said, "Well, I had a heart attack a minute after they gave me the shot." And then he mentioned that his wife got vaccinated as well, different time, different place. And she had, for months, she couldn't hold a glass of water. Her hand would shake so badly that she couldn't hold a glass of water. And so at this point, it was very clear that either these people were lying to me or this vaccine is not safe and effective. I have a lot of friends who say, "Hey, nobody I know has died. Nobody I know has been vaccine injured." Well, I didn't know my carpet cleaner was vaccine injured until I asked him. It was only if you took time out from what you normally do and spend your time looking at this data directly. You look at the VAERS data, for example. It's unexplainable. If the VAERS data, which is the Vaccine Adverse Reporting System, it's like a flat line. And then all of a sudden, it spikes up by more than 100-fold. And the individual doctors tell me that, "Oh, I've been in practice for 30 years. I've never had to report anything to the VAERS system. But this year, I had to report 25.
The norm is that VAERS would have been sufficient signal and that there would have been deployed in response to that teams of epidemiologists and medical scientists trying to get to the bottom of that. That clearly has not happened.
Over a 2-week period, 2 of my coworkers that were both physicians were vaccine injured. Every time I would go in for a cardiac MRI, they would tell me of all of these injuries coming in. I would do stress tests, and the techs would tell me, "Gosh, we are having so many younger people with palpitations." My MRI tech was vaccine injured, so it was becoming pretty apparent that this was a widespread problem and that the hospital knew something was going on.
And throughout the experience and the journey between all the different doctors' visits and ER visits, we'd hear something from almost each of them, but they wouldn't elaborate. Like their first thing would be, oh, did you get the vaccine? Which one? And then it would be silent and they'd be like, okay, moving on.
I had several nurses come in and, on the side say, you know what, you're not the first person we have seen that's had a reaction after the vaccine. I was on the ventilator, you couldn't even move, but you could hear everybody. And, you're there mentally, you were just trapped in this body. I would remember the doctors rounding, and they go through every single problem and the whole story of, of multiple hospitalizations, multiple intubations, but they would always leave out the fact of what started prior to it. I had a vaccine, and 36 hours later, this is the sequence of events that occurred. I was inside screaming, hey, come back, you're leaving out a big part. That's the connector, treat that, and maybe you could help me.
They are novel and unexplained presentations of a number of diverse symptoms. The doctor doesn't know what that is and how to treat it.
Hi, I'm Tanya Winter. I'm from Brisbane, Australia. I was severely injured from my Pfizer vaccine, and so was my identical twin sister. When I got diagnosed properly with my conditions, I went back to my GP and told him the diagnosis. He was like, oh, I didn't even know you could get that from the vaccine. I think I've got about 5 other patients with the same thing. So the fact that the authorities are not publishing for doctors what the actual side effects actually are means that people are being undiagnosed, and it means that they're not getting the proper treatment that they should have.
I don't know how much to blame the individual physician, because it's really how much, I feel that their behaviors were extremely harmful to the individual and public health of society. However, I do think their behaviors are a result of being lied to. And I think a lot of them didn't know they were being lied to. Some of them did.
I think also there may be an element of fear, that maybe they suspect that something is wrong, something isn't right, but they're fearful of their career, because we know that the agencies and medical boards have gone after people that have spoken against the narrative, and physicians have lost their license. And obviously that's, for a physician to lose a license, basically it ends their career.
Vilification of doctors who, were posting, a different approach, a different theory of the case, coming out of New York and saying, this is not what we normally are seeing here. And then they were being censored and their videos were being pulled down. And just like, there's so much information we don't know. How could anybody have the hubris to say, well, what that person's saying is just wrong, it's misinformation?
There's only one member of Congress who has consistently taken up the issue of vaccine injury. Senator Ron Johnson has hosted multiple roundtable discussions bringing together leading doctors, researchers, and patients. For his efforts, he's routinely criticized as anti-science, but he continues to offer one of the few venues for open discussion at this level.
People are scared to speak out because they see what happens. You shouldn't be afraid to speak out. This is supposed to be America where we cherish freedom of speech.
Steve Kirsch now dedicates all of his time and resources to the Vaccine Safety Research Foundation, an organization he started to address the issues of vaccine injury.
Truth should never be censored. And yet, nobody's coming to the rescue of truth.
It's not only doctors who are being silenced and vilified.
Have you personally experienced censorship in trying to share your story or anything about vaccine injury? If so, put your hand up now.
It's really sad that we're having to talk in code language, but that's what we're having to do on social media. We use abbreviated terms, we can't say certain words. So we've had to finagle a way to still communicate about our real injuries that happened to us because we're not allowed to talk.
The people that are in denial, like when you tell the story, and they still just, even people that we know, and family.
It was tougher when I would come back to school and it was like people I was friends with being like,
You faked it for social media though, so you get followers, right? So you could be like an influencer. And I was like, you think I just turned 21 and you think I wanted to spend my whole summer in a hospital bed? Like, what's wrong with you? They're like, oh, I just like had to check.
When the post that I did that I was desperate, basically, right? And the first, I would say 2 days was mostly negativity. She was faking it, that it's misinformation, that I should go to jail for misinformation, that I was doing everything in my power to kill other people because I was spreading this information, so I have blood on my hands now. Then they would also say, she deserves to die because she chose it, or that would serve me right.
Me talking about what happened to my daughter is misinformation. Like, how is that possible?
I don't know any other victim of any other crime or scenario where something goes wrong in your life where you're not allowed to talk about it.
How many times have you seen a vaccine injured or somebody that had a bad reaction on the news? They don't put it out there.
I've completely lost all my friends, about 20 or so people who abandoned me entirely over this last little over a year since I got my pulmonary embolism.
Unfortunately, I've been to this hospital many times by ambulance. I don't have a whole lot of memory of much of it other than it was emergencies I had. This place is pretty traumatizing. I have a lot of PTSD being here, especially as a nurse and a mother, knowing how sick I was. I spent all of my days writing her letters in case I didn't make it, because I didn't think that I would. And I think probably that was the hardest part of this whole vaccine injury, was leaving a 12-year-old little girl behind without a mother. I wrote her a letter, and I haven't actually looked at this since I wrote it because it's pretty traumatizing for me, but I will try my best. So this was, my vaccine was on the 19th of January. This was Valentine's Day. Dear Ella, I want to let you know on Valentine's Day that you are the love of my life. I prayed so hard that Dad would not have to give you this letter. I just want you to know how sorry I am that you are reading this. I never thought my body would react this way to the vaccine, and I thought it was the right thing to do. I fought so hard because my greatest fear was leaving you. I never wanted to do this to you, and I hoped I'd die a little old lady so I could watch you grow and be there for you as you journey through life. I know this is going to be very hard for you, but you are strong and you are resilient. Even though I'm not physically here, I will always live on in your heart. I am part of you, and that will not die. I want you to go live your life and experience all it has to offer. I've taught you so much in this short time that you can carry with you forever. My greatest advice is to always be kind and compassionate and love with all your heart. I loved you with all my heart, and it is what gave me the most happiness. Love, Mom.
It's hard enough going through it myself, but knowing how it affects my kids indirectly has been hard. I was always at every single game, always at an event, and now some things as simple as, hey, let's go out to eat after the ball game. And I have to tell them, well, I think we need to go home and eat. I'm not being a mean mom. You have to choose when you have financial struggles. Do you pick up these drugs? Do you pay for these bills? Do you pay for their extracurricular activities? Do you try to throw out all your money on a treatment that may or may not work, but it might be your only option?
I told them that it was done and that I was dying and that there was nothing else left because we've done every test in the medical book, everything's coming back normal, and the hospital and the doctors are telling me, come back when you're worse. I'm like, at this point, I have tremors, can't walk, I can't feel anything, I can't close my hands, worse it's gonna be my organs failing. And then what?
I literally watched a human being put the fire out of my child. And then as a mom, I have to figure out how to put the fire back on because we don't know what's going on.
I was hoping to teach my daughter to fly. She wants to be a pilot. That will probably never happen.
It's tragic. I can watch her take off. I can watch her land. I can watch her going through moments of, that I should be there watching, but I can't be there.
What's your reaction when people say, yeah, but it's a very small number of people that have any reaction to the vaccine?
What's an acceptable number for collateral damage? What number is acceptable to you, the harm? Is there 10%, 5%, 10 people, 100 people? How much tragedy is acceptable to you? Anybody, any of us could be collateral damage. It's just so impersonal. But they've made it personal for me.
I started adding more stuff in here with Junior during the services. So what I go through on a daily basis, waking up, knowing he's not here, coming home from work, knowing he's not here. If I go out to eat, I don't even finish the plate. I eat it, pick a little bit, and I throw it away because, I just don't want to eat, Because you see, all the pictures I had with me and my son, we would always go out to eat together.
My daughter was doing the right thing. She was doing what our government, the powers that be, suggested. And she did it with all the goodness and grace in her heart to help people. She was sitting people when they were with people when they were sick and their families couldn't.
People think, oh, they're, everything's being taken care of. That's not the case. Most of the things come out of our pocket. And then you start going to see other specialists that won't take insurance. A $50 copay, that's not such a thing. It's like, all right, today was $3,000 or $10,000. So it adds up quickly, and it's hard to explain to people. It's challenging.
My government made me believe that it was the right thing to do. And it's not. I regret it every day. I could have my son here right now if I hadn't listened to them.
C19 is a nonprofit started by Brianne Dressen to fill the gaps. It helps the vaccine-injured find each other, raises funds for expensive treatment, and presses the authorities to help.
In 12 short months, we amassed over 21,000 COVID vaccine injured here just in the United States. Between our partnerships globally that amount to close to 24 different countries, we're sitting at about 40 to 50,000 COVID vaccine injured globally.
A preschool teacher and mom, she herself suffered a severe neurological reaction to the AstraZeneca shot after eagerly joining the U.S. trials.
So I spent the next several months with my condition continuing to decline, fighting for my life, my husband calling repeatedly out to the drug company, asking for help, begging for help, and our cries for help went unanswered.
Finally, she got lucky. The National Institutes of Health, or NIH, flew her out to join a small-scale study with 22 other vaccine-injured, and it changed everything.
They know how to treat this.
How do they treat it?
What they've told me and others is that, that early intervention is key, and that immunotherapy, when it comes to an immune-mediated disease like a vaccine reaction, that the most important thing you can do is calm down the immune system and stop the attack in your body.
So they know what's happening, they know how to treat it, they know early intervention is the key, and yet none of that's being acknowledged and developed into some sort of program to help people who are affected.
Correct. And it's not like this, it's not like they kind of know. I mean, they flew us out. We were there in person. We were in the state-of-the-art facilities. They did all of the top-of-the-line testing They know at a very intimate level what's going on with this. They know about microclotting. They know about the nervous system breakdown. They know about small fiber neuropathy. They know about the cognitive issues. They know all of it. And so it kind of astonishes me that I was able to get that golden ticket to go to the NIH, to be evaluated, and for them to literally change the trajectory of my recovery when tens of thousands of Americans across this country were not afforded the same treatment, the same luxury, I guess you could call it at this point, since they haven't given that very essential and matter-of-fact treatment to all of the other Americans who stepped up and got their shot.
Knowing that help exists, Dressen continued reaching out to the health authorities to get help for others.
So Peter Marks, he's the head of biologics at the FDA. We've had 7-8 meetings with him at this point. We have 300 plus emails back and forth with him and his team. And they keep saying that they can't possibly find these safety signals. They can't possibly find them.
All new drugs are monitored for potential problems. Safety signals aren't proof of a problem, but they're meant to act as red flags, telling health officials there's something to investigate.
For us to make some kind of a statement publicly, we have to find the data in our database. We do look for major neurologic issues. The question for us is understanding what is related to vaccines and what is not, because sometimes that's a very challenging thing to sort out. You know, we have not, there's not a clear signal for the specific kinds of neurologic events that you have been reporting. But that's not saying that it doesn't exist. It just says that we don't have a signal.
So I remember back when the press releases started with myocarditis with the 6 cases, there was a press release that said, hey, heads up, we think that there's a signal. We're looking into it. So I'm trying to figure out why, with all of the cases and all of the data and how tightly correlated even with the timeline, why we're not seeing the same press release or communication be released about potential post-vax syndrome.
We struggle very diligently and to try to understand safety signals and to make use of them.
Well, Zach Stieber, with Epoch Times, he was able to get a FOIA. In this FOIA, the CDC did a full evaluation of the various signals, and they found over 700 safety signals in VAERS. The government found over 700 safety signals, 500 of which were stronger signals than myocarditis. A month into the public rollout is when we have confirmation that the heads of the NIH, the head of the FDA, have known about the COVID vaccine injured. We have emails with injured individuals with the heads of these agencies as early as February and March of 2021. And they're acknowledging that they're getting repeated reports of neurological injuries specifically to these agencies, and they were asking us to not publicize this and not go to the press while they figured out what was going on, and they promised us that they would disclose this to the public.
Have they done that?
They have not. We've had 3 suicides in the last 3 weeks. It's the beginning of winter, so it's going to get worse. So we're trying to give these people some hope. I sent you guys a suicide letter like 4 weeks ago, and I didn't get a response back. The man, he's gone.
VAERS wasn't the only alert system throwing up safety signals that should have been investigated. In fact, there were several. And what they have in common is that U.S. health authorities wanted to keep the data hidden from the public. For example, the vSafe app was created by the CDC to collect post-vaccine health information on a large scale. It was very effective. Within months, over 10 million Americans had enrolled. The Informed Consent Action Network, or ICANN, asked the CDC for vSafe's data. Aaron Siri is ICANN's attorney.
Was the CDC transparent about this information?
No. It took us a year and a half of legal battles to get it, 2 lawsuits in federal court. Only before they had no other choice did they finally reveal it. Here it is, about a 7.7% of people in VSafe reported needing medical care. 7.7%, that is 1 in 13 people. Most, 25% of those people needed emergency room care or were hospitalized, and another 48% sought urgent care.
The U.S. Armed Forces maintains probably the most complete database, recording every single medical visit a service member makes.
Defense Medical Epidemiology Database is the red flag, the sentinel alert. It's the Paul Revere of data to us as doctors to say, hey, docs, we're seeing a lot of X, Y, Z, whatever it is. In this case, it would be vaccine injuries. Then on 24th of January, Senator Johnson with Thomas Renz presenting our DMED data.
We've got 3 whistleblowers who've given me permission at this point to share their name. Lieutenant Colonel Dr. Teresa Long, DO MPH, Dr. Samuel Sigloff, and Lieutenant Colonel Dr. Peter Chambers, DO and Flight Surgeon. All 3 have given me this data. I have declarations from all 3. This data is under penalty. This is under penalty of perjury. We intend to submit this to the courts. We have substantial data showing that we saw, for example, miscarriages increased by 300% over the 5-year average, almost. We saw almost 300% increase in cancer over the 5-year average. We saw, this one's amazing, neurological. So neurological issues which would affect our pilots, over 1,000% increase, 1,000.
After the hearing, the Department of Defense said the database contained errors, and it took DMED offline to fix the problem. When it came back up, the baseline numbers were higher.
What they did was, instead of bringing this number down, they brought all these up from prior years. So it made it look like there was no change. But what I argue is, you mean to tell us that our military population was that debilitated? Who's failing at the entry stations when they're coming in? Who's failing? Because we're not that sick.
Yeah, I was a supporter of Operation Warp Speed. I thought it was pretty brilliant the way they squeezed all of the financial hurdles to a quick development. But again, I was unaware of all of the tests, all the studies that weren't being conducted in terms of ensuring vaccine safety. I think I was, like most Americans, had faith in these federal health agencies. I'm not a big fan of the federal government. But I recognize there are things the federal government has to do, and we want a federal Food and Drug Administration to be able to make sure that our food and our drugs are safe. And we want a Center for Disease Control to gather information on health trends and publish that in a transparent and honest fashion. So, and we'd assumed that they were honest brokers. They were telling us all the right things. They were going to, they held a 8-hour-long plus teleconference prior to the emergency use authorization of the vaccines that they were going to use, for example, VAERS as their safety surveillance system. They were going to take it so seriously. If you lost even a couple days worth of work because of a reaction to the vaccine, there's going to be a CDC representative on the phone talking to you to find out what happened.
Pfizer tracked adverse reactions for the first 90 days of vaccine rollout as required by law, documenting over 42,000 cases. They didn't make any of that data public, however, until they were forced to.
A judge in Texas has ruled that the FDA cannot take 75 years to release data about the COVID-19 vaccine, saying they got to make that info public in about 8 months. Public health and medical professionals for transparency said the data can and should be released quickly because it only took the FDA about 4 months to review that data before granting full approval for the Pfizer vaccine.
We know that in the first 90 days, the data reported to Pfizer, and we have this in black and white, it's released by the FDA and Pfizer. There were 1,124 deaths directly related to the vaccine and over 42,000 adverse events, many which were serious adverse events.
Pfizer should have been off the market by February 1st of 2021 based on their internal data. No one's challenged that. No one say those deaths didn't occur. In fact, Pfizer recorded them.
And so they list the conditions associated with the adverse events. It's 8 pages long. There are 8 pages of medical conditions directly related to the vaccine.
Why would the FDA have to go to court and ask a judge for 75 years to release that data? The conflicts of interest are so large, in fact, unprecedentedly large. You're literally talking about a product that had the capacity of being an instant product to billions around the world. So just thinking of that, is it possible that they manipulated or suppressed some of the data that they didn't want to come out?
It's useful to think in terms of incentives. The threat of costly lawsuits incentivizes companies to ensure their products are safe. For vaccines, that incentive doesn't exist. Since 1986, vaccine manufacturers have had blanket immunity to liability, meaning no matter what happens to a person after taking a vaccine, the manufacturer can't be sued.
I think we definitely have to revisit the blanket immunity we've granted vaccine manufacturers. That allows all these vaccine manufacturers and the regulators to pretty well throw caution to the wind when caution should not be thrown to the wind.
Robert Krakow is a New York attorney specializing in vaccine injury law for the last 20 years.
It's the policy of the U.S. government that people get injured by vaccines. We know that, and they should be compensated. But the program is so inadequate that there is really almost no opportunity for justice.
The specific program for emergency use vaccines is called the CICP, or Countermeasures Injury Compensation Program.
That program is completely inadequate. There's no provision for attorneys. There's no judicial process. It's totally confusing. There's no understanding of what the standard is for who gets compensated and who doesn't. Now, there's a very short statute of limitations. It's 1 year from the date of vaccination. Sure. And so give me a little time and I'll be right back. You're welcome. So that was an example of a call. His son has stroke, cannot speak, and he believes it might be from the COVID vaccine, and it's probably more than a year, and I'm going to have to give him all the bad news, but I will.
A 1 year statute of limitations is absurd. I would be very concerned for a lot of these people that we're going to start seeing some very chronic illness pop up. They're not going to have the ability, if we keep it at 1 year, they're not going to have any possibility of filing a petition for compensation. They're cashing in all their retirement savings. Some are even selling their homes. This is a mess. I estimate within the next 10 years, it's going to cost at least $1 to $2 trillion to compensate. Medicaid, Medicare are going to pick up a large chunk of this because these people are disabled and they're going to start filing for disability benefits, Social Security benefits. A lot of dominoes are going to start falling soon if we don't get our compensation program moving forward. Also, I think there's a lot of people that don't know that they're injured.
There is one way to sue the drug makers for these vaccines, and that's exactly what Brooke Jackson is doing. It needs to be proven that the companies engaged in willful misconduct. Jackson launched a lawsuit under the Federal False Claims Act, which allows private citizens to sue on behalf of the government if they believe a person or company has defrauded the government.
I was able to bring a case against Pfizer and against Ventavia for the misbranding of their product. So because I was employed by Ventavia and documenting everything that we've talked about, it allowed me to file this lawsuit on behalf of the United States government and our citizens.
Pfizer contends that, the FDA and the DOD, they knew all this. They knew all the problems with the trials, and yet they didn't stop payment. And we say, no. Our allegations are you committed fraud to trigger those payments. If we go back to that time frame and take that bad data, that bad analysis out of the equation, no objective FDA commissioner would have ever granted you that emergency use authorization. I see this as a serious battle, literally, to try to correct the breakdown of our bureaucratic structures that were supposed to keep us safe and did not.
One of the most important things that the COVID vaccine injured need is they need recognition. It all starts with recognition. Until people can see that this is a problem, nothing is going to be able to be addressed. If you can't see it, then you don't know that it needs to be fixed. They're invisible. Those people that are walking around with this screaming in their head 24/7, you're not even going to suspect that the person that you just passed by is enduring an unbelievable hell every single day of their life.
We need a wholesale remake of these agencies, return them to what their function should be. The FDA should be concerned about safety. And CDC should be concerned about gathering and then disseminating accurate information.
We can never have the FDA and the CDC be sponsors of a clinical administration program like this. The FDA's role is to be the safeguard, to be the drug safety watchdog. In this case, the FDA is the sponsor. They're the ones, in a sense, giving the needle in every arm. They cannot be fair monitors and protectors of public health when they are a sponsor of a program.
I mean, how can you do nothing? How can you say, well, you know what, I don't know what this is, we can't treat you. I mean, that's inhuman and that's just cruel.
This girl messaged me saying that she had similar symptoms from something else, but had a doctor in LA that helped her. And she's like, I'll put you in connection with him. And he instantly was like, let's go.
Friday, we were in the office and we were the only ones in his office on his birthday to see her. And after not being listened to or heard or being like silenced, and you almost feel as if you were like shouting from the rooftops, and people are right there and they're looking up at you, but they're like right past you. And this person within 2 minutes was like, we were the only people in the world that existed, and listened to everything. And then you look like someone stuck a light bulb in him, and he was like, I got this. Do you trust me? I have no idea why, but I do. I absolutely do. And that was like the weirdest, biggest turning point, but almost one of the weirdest feelings, because we had spent months and months and months of not trusting.
Not a huge fan of the needles and such.
He started the IV therapy, and literally within an hour, change.
Within an hour, I was able to walk and close my fists.
The first bright neon yellow bag, basically replacing a lot of stuff that her body had been depleted of over the last several months. And then just the glutathione, magnesium, a lot of amino acids, peptides, so many things that her body was just so depleted.
I think it's important to mention too that he was a naturopathic doctor, functional medicine. So different than any other doctor we had worked with. It wasn't something I ever really thought of. I didn't know a lot about. It definitely changed my life for the better.
Yeah.
Do you have concerns about long-term impacts?
I think my biggest one is my reproductive health, which is like something I don't want to touch on because I'm scared, but I know that I should get it checked out. I still have a lot of the cognitive and comprehension problems. I still have twitches. I still have the numbness on my right side. And I don't know if that will go away.
I was one of the lucky injured. I had the best doctors, medical team taking care of me. It was people that I'd worked with, so they knew me really well, and they knew this was vaccine related because I am a nurse and because it was so immediate. So they were fighting as hard as they could to keep me alive. A lot of ups and downs. I tried experimental medications. I tried IVs. I did intermittent fasting. I did so many different things that I really can't pinpoint one thing. This is just a small example of some of the supplements that I was on. I've done so much healing, and I feel like I am at about 99% better.
To the vaccine injured, finding others who are going through the same thing is like a lifeline. And on rare occasions, sufferers who formed deep bonds online get to meet in person.
people, try and help each other, one of the things that I've tried to do is help. I can at least tell them based on what their symptoms, what to ask, being in the medical field, what tests to do. Even if their doctors don't believe that, we help each other more than the medical profession
Totally.
has.
You're gonna have to do it and actually
Use it for yourself.
Live. Yeah. So that was I don't recognize the person I am now as the person I was a year and a half ago. Although it's a terrible thing to have ever gone through, I think I was meant to go through it. I was able to get a platform with my mom through sharing my story and help thousands of people, whether it was in my support groups, whether it was talking people out of suicide, being a support, and just learning that you can be so much more than yourself. I think I've become someone I can be proud of.
You start giving yourself more credit that you're going to be able to make through tomorrow, whatever it throws at you, because look what you made it through. I have a strong faith that, sometimes we're tested, sometimes we're trialed. I do believe that evil exists, and I do believe that, sometimes we have to find the good in things, and sometimes bad things can be utilized for our good.
I just never thought that she wouldn't get better. I did not think it would take this long, but I did trust God, and just so many things have God's in this, and I think he's doing it to make us better people. For Maddie, nothing's gonna stop her. It's also showed me how resilient she is, how adaptable she is. Nothing's gonna knock her down.
She's strong. Maddie's super strong. I don't know how she's doing it.
My goal now is to be the best dad that I can be, the best husband that I can be, and to use my voice, as it's been given to me, to try to get the word out and get at least people to try to acknowledge, or at least, question what they're being told.
We're finding each other and we're coming together and we're being seen.
I suffer daily with my injuries, but I'm honestly grateful that this has happened because I will never take anything for granted again. I just want to be a voice for the voiceless, share my story in hopes of getting support for myself or to help other people.
And for those out there having the same symptoms, I'm still fighting for them and for me.
I figured I needed to honor my son because he didn't die for nothing. That's why I started fighting, trying to bring awareness.
The only thing that I can do now is try to help others. I don't want any other family going through what I'm going through.
So for words of encouragement, I firmly believe we are frontline injured for a reason. We are the ones who had to battle through and find our way, to find the modalities that work for recovery, to find the medications that are helping us and helping others. So in all of the darkness that we've endured, we will bring light into somebody else's life.
Everybody, we are united in this and we'll get through this.
The injured community at large, it's an incredible community, and whether our political views are liberal or conservative, it doesn't matter. You go in, you say, my life is ruined, I'm sick, I'm dying, I need help. And it's incredible to see just who surrounds you and who buoys you up. And then also those that see the injuries and support us and stand by us.
Thank you. Thank you all for being here from the bottom of our heart. It means more than you know. We've put together the brightest minds to try and start us on this journey to healing and helping these people. We now recognize that we have to do this ourselves. We're going to build something better. And I think this is the first step of our mission to try and educate physicians as to the breadth and the depth of the vaccine injured and how to treat them. This is going to become a catastrophic issue, and we need to spread the truth so that more people Our fellow human beings need to know what's going on.
destined for great things still. It's gonna be something big. The other day, we had a conversation. And I said to her, wouldn't it be funny if this was the best thing that ever happened to you?
Maybe.
And that was the answer back. Wouldn't it be funny? Like all this is hard. I'm gonna.
Oh, yeah.
We are gonna move mountains. This is not
massive mountains.
Just the beginning.
This is just the beginning.